Hello, everyone.
Hello.
Hello.
Hi.
I'm Dr. Vassar. We'll let some people continue to trickle in, but thanks for everyone for being prompt. It's really excellent to meet you, and for some of you, I have met you before, so thank you so much for coming. And thank you so much to the Gould Syndrome Foundation for hosting me. I'm really looking forward to this opportunity to talk a little bit about some research that we are doing here at UCSF about Col4A 1 and 2 related disorders. And I will just say just a few things before we dive in. This is being recorded, so if you don't feel comfortable with that, then obviously feel free to leave or hide your video. But the goal of this is, of course, we have people all over the world who want to watch, but it might not be a good time for everyone. So we will be I believe Lacey will be posting this online on the Gould Syndrome Foundation website, so you can watch it again if you want, or share. All right. Well, I am going to share my screen and we can dive in. I will say that I'm going to start with background and talking about our natural history study. And I want to also make this as interactive as possible, though. So feel free to put questions in the chat. Lacey will try to help and make sure that we address any of the questions. Please try to keep any questions, related to the natural history study. Um, but at the end, we will open it up for the audience and broader questions if you have them, and we can try to make it a discussion. So, without further ado, I will start. So today, I'm going to be talking about our Col4A 1 and 2 natural history study. As I mentioned, I'm Dr. Rachel Vassar. I am a pediatric vascular neurologist by training. I'm in the Department of Neurology at University of California, San Francisco. And just a little bit of background about our institution. So we are located in San Francisco in California. This is our lovely hospital, the Children's Hospital specifically in San Francisco. We do have an affiliated adult hospital across the city. And I am very fortunate to work with a great group of doctors and researchers. This is only a snapshot of our group. Of course, everyone on this call probably knows Dr. Douglas Gould, who discovered Col4A and has continued to research it primarily in mice for the past 2 decades. Really has brought this community together, and we are so grateful to him for all the work that he has done. I partnered with him several years ago after seeing several patients throughout my training with Gould syndrome and became very interested in the condition because as a pediatric vascular neurologist, I take care of children who have strokes, hemorrhagic strokes, and of course started to see more and more patients that had Col4A 1 or 2 variants. And so partnered with Doug to study this disease more from the patient side of things. And then I have these other collaborators as well as many more who are at UCSF who are helping me with clinical care and research for this population. A special shout out to Dr. De Alba Campomanes, who helps from the eye perspective. She's a pediatric and adult ophthalmologist and sees the majority of our patients with Col4A 1 and 2, and will be helping to collaborate on this research study. So I will dive into the what is a natural history study. So you may or may not have heard that term before, but a natural history study is research that observes the disease over time without any specific intervention. And the goal is to better understand how the disease progresses and affects patients. So why specifically a natural history study? So, as I mentioned, the number one goal is, of course, to understand the disease. We are fortunate to have, the Gould Syndrome Foundation and sister foundations across the world who are helping to join patients together and really understand the spectrum of this disease. But in all reality, it's only been, a decade, I'd say, generously, that we have been identifying people with this condition and, starting to really publish data on what this condition can cause. And so I would say that we are still in our infancy of really understanding Gould syndrome. And so we need to have an organized study that is helping to characterize the whole spectrum of how COL4A1 and 2 variants can affect people. So, of course, another goal is to improve care. Many of you, if not all of you, are, patients or family members of people with COL4A1 and 2. And I suspect after having taken care of many patients with COL4A1 and 2, that you've had the experience that you have many doctors, or maybe all of your doctors, who say, I've never heard of this. I don't know how to take care of you. Well, the only way that we can improve our ability to give, disease-specific medical recommendations is through research. And so by looking at how this disease affects people across the lifespan, the spectrum of the disease, that data is going to directly inform us doctors in taking care of both current and future patients with COL4A1 and 2. Of course, another goal is to accelerate research. So, with rare diseases in particular, it sometimes feels really frustrating that we don't have treatments. We don't really know a lot. And the only way that we're going to move forward is to accelerate this research. And so, this is a natural history study is a mandatory first step before we do any other type of research study like a clinical trial. So I know many of you are probably eager to know when can we do a study that looks at a drug, a specific treatment that might be helpful in Gould syndrome. Well, I think all of us are hopeful that that is possible in the future, but before we are able to do that, both logistically as well as, to get funding to do an interventional study, we have to have really good data on how does this disease normally kind of just progress over time or not progress over time, because that will inform what are potential treatments that could be helpful, which patients in the population would be appropriate to consider giving a treatment for. As many of you know, not everyone with Gould syndrome actually has any symptoms, actually. And so, does it make sense to give a drug that could have side effects to everyone with this disease? Maybe not. Or perhaps people who are mildly affected are the ones who have the most to gain from a treatment because they have not developed symptoms. We want to prevent them from developing symptoms. We don't have answers to these questions yet because we need to have a natural history study to really better characterize the spectrum of disease. And of course, our another goal of ours is to empower patients and families. And I imagine that it can, again, feel very frustrating to feel like we don't have a lot of treatments or we don't have any treatments. We don't have a lot of answers often. But I do think that, being part of a research study is something that you can do to help, the community, to help yourself potentially even in the future. It is a thankless activity, but the hope is that if everyone does a little bit to help participate in research, that collectively a little bit of effort on a lot of people's parts will help, generate a lot of data that will move the research and the clinical care forward in this condition. So you might think, well, what prior research is out there that is, informing what we do know about Gould syndrome? So there are a lot of publications out. I would say the majority of current research on Gould syndrome is of a few different types. There is no natural history study that has been performed to date. So the majority of data is either from mice, which of course is a useful way to study this disease, though mice are not exactly the same as humans, um, or case series where doctors, researchers identify a group of patients, maybe all the patients that they've seen at their hospital or a large family, and they describe what they are seeing in those patients. I will highlight a few publications that are from the past few years. This is a publication that came out in 2021 that was directly out of the Gould Syndrome Foundation. So there's been some changes in leadership at the Gould Syndrome Foundation, but several of these authors were members or leaders of the Gould Syndrome Foundation a few years ago and helped put together a study that surveyed patients, about 100 patients, I think were surveyed over 20, I think 2019 to 2020 or so, and helped to provide information about, specific, all sorts of different complications related to the condition. And based on this registry, there is one to date publication about specifically the epilepsy in the children in the cohort. This was a very useful registry, and I am fortunate enough to actually have the data now, and we are working to publish more papers related to this data. And I encourage everyone to go out and read this paper. And I will say, this is helpful and also is just a snapshot in time. So the difference between the registry that happened, 4 or 5 years ago, and what we are now doing with a natural history study is that this survey was surveying patients, which is very useful, hearing from them about all the different disease complications, but it wasn't specifically looking over time how things change. So it can look backwards, say what things have happened up until now that are probably related to COL4A1 or 2, but doesn't answer the questions of like, how does this disease then look going forward? And then another publication that I will highlight is a paper that came out in the past year from our colleagues in Italy. And it's an excellent paper that summarizes, it's what we kind of call a meta-analysis, although they also did a little bit of their own surveying of maybe 40 or 50 patients to add to the meta-analysis. And overall, they were able to quantify rates of different complications in patients with COL4A1 and 2 in about 600 patients. So, that's a sizable group, obviously. And the larger the group, the more we can learn. Uh, and I will say, this study or this way of researching by looking at all the publications that already exist does have some biases. And so I think that the literature that is published on Gould syndrome is likely biased towards the more severe presentations because for better or worse, researchers tend to publish papers on people who are really, a surprising case or a really dramatic presentation of something. And there's, a little bit less incentive to publish on a patient who has no symptoms or minimal symptoms. And so I think that, really to better understand how this disease affects people in all ways, we need to, try to capture the whole spectrum of the disease. So, as I have mentioned, these are kind of our main goals of this natural history study. So number one, we want to better characterize the spectrum of COL4A1 and 2 related disorders across all ages and severities. This includes looking at all systemic complications. So I think there's a bias in the literature towards publishing about the neurologic or brain manifestations, the eye manifestations, and then the kidney manifestations. I think actually some of the earliest literature was focused mostly on HANAC syndrome or some of the kind of the kidney related conditions. But there's essentially nothing published on several of the organ systems that we actually know can be quite affected in COL4A1 and 2 just from patient experience. So the GI tract or the lungs or the urinary symptoms. I see people nodding, and I think just in having had the opportunity to connect with the community and taking care of many of my own patients with Gould syndrome, these are the things that actually people are asking me about, and it's so hard because we have basically no data to say how common these things are. What do we do about it? So also, as I mentioned, understanding change over time is important. So it's another very common question that I get in my clinical practice is how is this disease going to affect me or my child moving forward? And of course, that's, probably one of the most important questions on everyone's minds. And it's tough because we don't really have good data to answer that question. Probably it's going to look different for many different people, so I don't know that we will have a perfect answer to it even with this data. But I do think some concrete questions could come out of this study, like how likely is it that my child will have another stroke in the next 10 years? We don't know. But I think that by looking at people over time, following them longitudinally, we can get a better sense of how common it is that people have recurrent or new events come up after they have the diagnosis. Or there may be, a subset of people or a majority of people who actually have no change at all. And, they have changes related to the symptoms they already have, but don't develop new complications specifically over the span of, 5 or 10 years. And that would be important to know too. Another goal is to, of course, obtain objective data from medical records as well as subjective data from patients' firsthand experiences. This is important for a few reasons. So, as I mentioned, the registry that the Gould Syndrome Foundation did a few years ago was very valuable and was sampling from patients and hearing about their symptoms. And that has strengths and limitations. Patients are at the core of this research, and we want and need to hear from the patients and their report of their symptoms, how, the disease affects their daily quality of life, etc. But it's also helpful to try to match that with people's medical records to have very specific kind of diagnoses, have access to things like neuroimaging reports, a brain MRI report, lab values, etc. And of course, not all patients are going to be able to readily, describe exactly the findings on their brain imaging reports. And so it's helpful to have both of those pieces of data that each have their strengths and their limitations. And then lastly, as I mentioned, another goal is to eventually prepare for a clinical trial. And before pursuing that, we need to have a natural history study. So, eligibility, who is able to participate in this research study? So we're trying to be as inclusive as possible, but also just focus on Col4A1 and 2. So the main piece of eligibility is you have to have had genetic testing that shows, or you or your family member has to have had a genetic testing that showed a Col4A1 or a Col4A2 variant. Or in rare cases, some people have a variant or deletion of both. The variants can either be identified as pathogenic, suspected pathogenic, or a variant of uncertain significance. We certainly have a lot of patients who have VUSs or variants of uncertain significance. Their doctors may have told them, I don't know if this is even relevant, but those are patients that we still want to include in this study because the only way we'll be able to understand if these are in fact relevant variants or not is by studying them. We want to include people of any age. So theoretically, we're able to enroll fetuses even, so before you're born, all the way through the end of life and post-mortem even. We want to capture the whole spectrum of patients. I think actually there's much better data relatively speaking, on children, much less data on adults. And so, actually, though I am a pediatric provider, I am very interested also in the adult manifestations of this condition and have colleagues on the adult side that can help with thinking through kind of how to best characterize the adult manifestations of COL4A1 and 2. So any age, any location. So, we are physically located in San Francisco, it is true. And there are some parts of the study that are really only possible in person, but the majority of the study can be done remotely, entirely remotely. And this has benefits and limitations, of course. Relying on digital transfer of files um, requires some trust in the safety of transfers over the internet, but also, um, the real benefit is that when a rare disease, you need to have as many people as possible, and we know that there are people all over the world who are, experiencing symptoms from Gold syndrome, and we want to include them. We also are happy to have people who are very symptomatic, possibly symptomatic, or asymptomatic. I think it's really important to capture that disease spectrum, as I said, particularly the asymptomatic patients who really to date have not been well characterized in the literature. And I think there's this concept of being asymptomatic, we think, but then potentially as time goes on or they get specific healthcare or screening tests in relation to their genetic diagnosis, they may identify that they actually might have some subtle symptoms related to the variant or unrelated. So, what does the study entail? So, as I mentioned, the majority of the study is what we would call observational. So, we're just observing the normal kind of change or lack thereof in a patient over time. And there's both retrospective and prospective data collection, meaning that we will look, at the time of enrollment, we will look backwards and say, okay, what has happened in the person's medical history up until now? And then also the goal is to follow patients over time so that we're looking forward and saying how, if at all, does the person's symptoms evolve over time. And our goal is to have this study going for, about 10 years is my goal. I'm hopeful we'll have data and be able to publish about this before the 10 years is up. But the idea of having this long-term study is that the longer you follow people, the better you understand, the complications. Uh, I don't have a specific need to cut off the study at 10 years, but at a certain point, there's probably diminishing returns on continuing to follow people. But certainly we may and probably will continue to follow people beyond that. So, luckily, in this era of electronic medical records, the majority of patients that are enrolled, are receiving care at a hospital that has some form of electronic medical record. And, with your permission and consenting into the study, it allows us to try to access medical records that are at your local institution and connect it to our electronic medical records. And that is nice because then, of course, the patient does not need to really do anything to help share their medical records with us as the study team. That is not always possible. So for people who are international in general, there's no way to um, directly connect the medical records, but we have ways to work around that either by faxing medical records. We have a secure Dropbox where patients can provide any medical records that they have access to and send it to us, and we will put it in the patient-specific secure Dropbox.
Oops, sorry. Didn't mean to do that.
Um,
Somebody's calling you.
oh, perfect. Uh, Another main part of the core part of the study is patient surveys. So in, the research team is once the patient is consented, they, will work to get access to the medical records and review that in a standardized way of the patient. But then the patient has a little bit of work to do on their end where they will receive a baseline questionnaire that goes through health history, current symptoms, uh, based on organ system. So kind of a thorough assessment of each different organ system, how that it might be affected or not. A brief survey on research priorities that is important to help us, guide exactly our goals as researchers and clinicians. And then also a survey on quality of life. So what is your kind of day-to-day quality of life? We realize that's just a snapshot in time, but increasingly that is a really important piece of data that actually the funding agencies like the NIH look for in understanding whether or not it is important to pursue a therapeutic intervention for a disease. So, in total, I'd say the patient surveys take up to maybe an hour, but I'd say for the majority of people, probably could be done in 15 minutes or so. There's one baseline questionnaire that you go through if you right when you enroll in the study, and then the goal is that we will be in touch approximately once per year to just ask, are there any updates to your health history, etc. But it's not something that we will be contacting you like every month or anything to bug you for updates. And there, as we go, may be some additional optional study components or questionnaires that come up because we realize that, different researchers may have questions and patients who have agreed to be in the study, we identify as people who, are interested in contributing. Always at every point, patients are allowed to say, I don't want to participate in this, or I no longer want to be contacted, because we realize that everyone's lives change and you may want to be part of a study and then decide later on you don't. So that is always okay. And then I also will mention an optional component of doing a blood draw at UCSF. If you're undergoing a blood draw for clinical purposes, right now we also have the ability to do take some additional blood for research purposes, and specifically for something called biobanking, where we save the blood in a way that can preserve it for long term. And then are able to do a variety of different studies, research studies on the exact tissue sample, both either blood samples, and then actually my colleagues have the ability to basically take blood samples and turn it into stem cells that can then be differentiated into different tissue types. I realize for many people or some people that might sound like too much of a weird thing to participate in, and that's why this is completely optional. But for some people who are, comfortable with that, this is a really important way that we are going to learn more about how different exact variants or mutations affect cells. And so actually being able to grow cells and blood vessels in a petri dish will help us understand how COL4A 1 and 2 variants can interrupt the development of blood vessels. So, I think that step is going to be a critical step for us moving forward to things like, is there a gene therapy that could be helpful for this condition? But we don't need everyone to participate in that. I think that realistically, we only can really even study this in a subset of people. And so the blood draw portion of the study is entirely optional. So just to highlight a few other things. So as I mentioned, participation can be fully remote. You never need to come to California to be part of the study. You just have to have internet connection. All data is stored securely. So everything about this study has been vetted by our institution, UCSF, which is a major research institution. And to be doing any research to begin with, all of our protocols have been assessed by our IRB to make sure that everything is secure. So to the utmost ability that we have possible in 2025, all data will be stored, securely and not shared with anyone who should not have their hands on the data. So only the study team at UCSF has access to any identifiable information. There is the potential that we could share de-identified data with other collaborators outside of UCSF. So de-identified data means that we have removed your name, your date of birth, anything that could be identifiable, except for, I would say, your specific genetic variant. That is sometimes considered to be an identifiable piece of information, because, of course, there aren't that many people with this condition. So your exact variant, theoretically, someone could tie that back to you if you've like posted about your variant on the internet, for example. That, as you can imagine, is key information for us as researchers. But apart from that, you know, that piece of information, we would never have the ability to share any identifiable information with people outside of our study team. The goal of having the ability to share de-identified data, though, is so that we could share data or pool our data with other institutions to make an even bigger data set and publish on it. So we currently have the ability to share de-identified data with our collaborators at Massachusetts General Hospital, MGH, in Dr. Musolino's lab, so that we can make sure, are we enrolling the same patients into our two studies? If so, we don't want to duplicate their data in our data sets. Um, and also it kind of allows for people to participate in research at multiple sites without having, or at one site and not feel like they need to also be part of a study at another site. But I would say the majority of, or all of the data right now is just being stored and analyzed at UCSF specifically. As I mentioned, this is the case with any research study. You always have the ability to withdraw from the study at any time. That could either mean you say, I know I don't want to be contacted in the future for any future research, or you could say, I want you to remove all data that I have ever shared with you from the past, and we would comply with those requests. And then I will say there's no cost to participate, which is nice, just the cost of time, which is valuable. And there's no compensation specifically for participating, but hopefully there is some feeling of contributing to the research community that has some benefit, even though it's not money. I'll also mention this is a critical piece that participation in the research study would not at all change your specific medical management. So, as I highlighted before, this is a purely observational study. We are watching to see what happens over time. So, this would not at all change the treatments you're getting or how frequently you're being, seen by a doctor or imaged or anything like that. So, progress so far. So we started recruitment in June of last year. We intentionally started a little bit small and weren't widely advertising it because we needed to make sure all of the kinks were worked out before we went bigger. But so far we have recruited 54 patients. We are very grateful to those patients who have participated so far, and many of them are actually here in the audience. They're of all ages, so from underage 1 to I think the oldest patient is in their 70s. And we have patients from 6 countries, I believe. That might be a conservative estimate. So, of course, key piece of information, I will share this, but how do you participate? So if you are interested and you have not already signed up to be part of our natural history study, there are two, well, this is the main way to contact us. So emailing our study team at col4a12@ucsf.edu will, you can basically just send us an email and, give us some basic information, just like, oh yeah, this is my name and I have a col4a1 mutation. And we will send you the additional information about the study, as well as the forms needed to consent and sign up for the study if you choose to do that. Emailing to get more information absolutely does not require that you ultimately decide to participate in the study. And this QR code I think, should open your email and directly allow you to send me an email expressing interest. And of course, if you don't do this now, I think that the Gould Syndrome Foundation has this information also on their website. And so certainly reaching out to the Gould Syndrome Foundation would be another way to go about this in the future. So I will go back to this slide in a moment, but um, I think I've addressed most of these things, but just to say a few frequently asked questions. What if I'm located outside of the US? That is totally fine. We love our international participants. There are a few additional hoops to jump through just because of the electronic medical record sharing is a little bit more tricky, but for those of you in Europe, we do have specific authority to look at genetic data for European citizens. There's actually additional protections on Europe around sharing genetic information, but that is all okay per our IRB. Are you eligible? As I mentioned, all you need to have to be eligible is either you or your family member has a variant in either COL4A1 or COL4A2. How is it different from other studies occurring? So, as I mentioned, this is, as far as I know today, the only COL4A1 and 2 specific natural history study taking place in the world, which is very exciting. That being said, there are other institutions and groups studying um, collagen and collagen vascular disorders, and I will particularly highlight the group at MGH with Dr. Mussolino and her lab. And they do have a study that is recruiting for the YGSA Young Genetic Stroke Alliance, looking at people who have had strokes from a variety of genetic causes, and they're collecting very similar data as as we are in our natural history study for COL4A, but technically that study is not just about COL4A1 and 2, it's about a variety of genetic conditions. But if you participate in one, you do not have to enroll in the other because as I mentioned, we'll have the ability to pool our data in a de-identified way in the future. And then another question that comes up often is, will you be investigating treatments? So not directly, we are not going to be, giving people any medications or suggesting medications that people try to see the effect of that. However, we are collecting information on what medications are people taking, what are people trying for helping with symptoms. And so, before we are able to do a prospective, clinical trial registry, I think it is helpful to get a sense of what medications people are on. Are they tolerating them? Have they had major complications due to some specific medication? It's not as rigorous of a way of studying it as giving a patient a drug and monitoring it over time, but it is probably going to be the best way for us to answer some questions about what medications are safe or not safe, and what medications are potentially helpful. So with that, I know I've talked a lot. I want to open up the floor to questions. And I see that people have put some good questions in the chat. Um, Let me just look at it and then people can chime in. So yeah, people have asked some good questions. So we are definitely open to any people who have mutations beyond COL4A1 and 2 variants. We realize some people sometimes have multiple mutations, um, including ones not affecting these genes. So as long as you have an abnormality in one of the COL4 genes, it's okay if you have other variants. Um, People have wondered about other types of collagen mutations, so like COL6A, COL1A, and those variants in those genes have, it seems like, very different complications. So currently, this study is just intentionally focused on COL4 and 1A1 and COL4A1 too. Definitely agree that no one should withdraw from any study. The Massachusetts study is a great study, and I encourage people to be part of that if that is easier. Um, as I said, my study is only looking at col4a1 and 2, which has some benefits because then I'm asking questions very focused on the known and suspected complications related to col4 related variants versus the other ones a little bit more broad. And those are all the questions in the chat. Who has questions for me that they want to ask in person?
Hi, Dr. Vassar. I'm Michelle Harrison. I'm using my daughter's Zoom account right now.
Wonderful, wonderful.
I'd be interested to find out, given that we have 3 family members with a unique location on our gene marker, what information would be used and helpful publicly to share about symptomology such that practitioners and clinicians and support teams could actually have a good running list of symptoms to look out for or to be aware of. We're calling from Canada, and there really isn't anyone here who has any knowledge about that here. So I think my hope would be by participating in a research project like this, it may help to formulate symptom lists that could be helpful for doctors and clinicians and even family members to monitor. Is that something that you hope to do with your research project?
Yes, the short answer is yes. I think, the more patients, the more variants that haven't been discussed, the more symptoms that we haven't heard about, the better.
Mhm.
And of course, you know, every person has a variety of symptoms, and it's sometimes hard to know just with one person or one family.
Mhm.
Can we say that any or all of these symptoms are definitely related to the col4a, or are they unrelated? But when we
Mhm.
start to pool that data and start to see, oh, this is a recurring theme that this, muscle cramping is something
Mhm.
we know that can happen in a subset of patients with col4a1 or 2, then
Yes.
we really start to build up good lists of, yeah, these are the most common symptoms that some people experience. These are rare symptoms that only a few people report, but
Mhm.
that's definitely a big goal. And I think you mentioned that your family perhaps has a variant that hasn't been identified,
Mhm.
and maybe is not classified as pathogenic. And that is a very common issue actually in this condition.
Mhm.
And our hope is that um, by getting more information on all of these patients around the world who are clearly symptomatic and have documented variants in col4, that we can actually feed back in an anonymized way, feedback to the genetic testing companies and the databases that
Mhm.
help to determine if something is truly pathogenic or not. Because I think right now there's a very high bar to label something as pathogenic. And
Mhm.
honestly, the majority of patients that I see who clearly have, Gould syndrome or clearly have col4a related disorders, their variants are labeled as like unclear
Safer.
if this is relevant, right? But like they're clearly relevant. So I think the more new variants that we can include, the better.
Thank you.
Yeah. There's a few good questions also in the chat that came up. So, is it common for people with this variant to have other collagen variants, specifically like a col5a2? That is a great question, and we do not know the prevalence of this. I think it's possible, but I can't say that it's at all the majority of patients. So, something certainly that we will hopefully better understand through this research. Um, and definitely, in terms of kind of different clinical problems that come up in the patients, we've designed the surveys for patients to be as inclusive as possible, so that we have a systematic way of asking about different symptoms or organ system complications, but also have the ability for like a free text, other symptoms that we may not have specifically asked about. Um, so that's, yeah, a great question. We all realize that in designing the surveys, there's always some bias based on what we already know about the disease, and we want the ability to discover new things about the disease in this process.
I have a question.
Yes, please.
I was looking up because the different variants, I was looking and there's like 27 pages on, I forgot what government website because I was looking for my child specific one. And for him, there's only like, I only seen two people, him and somebody else with it. How, I mean, it's such a wide variety of different variants that how are you going to be able to narrow it down for the ones that are more pathogenic, I guess, than the other ones because his is pathogenic and I was looking at some of the other ones and they're not.
It's a great question. It's a tough question because um, there's a lot of different strategies of this. We luckily have sophisticated computer modeling nowadays that just continues to get better and better, where basically you can see um, if you have the whole gene and every different there's a lot of amino acids that make it up, and a variant is where there's a change in one or more amino acid that's in the whole line of the whole gene. You can use the computer modeling to see how the change predicts the folding of the protein that's made by the gene, and whether the folding of the protein is abnormal or not can sometimes help predict whether there's going to be a change in the protein or the collagen expression. Um, so computer modeling, looking at other patients to see their symptoms is another way. And then sometimes looking in cells in a petri dish, basically, we're able to look at specific expression levels of collagen and see is the amount of collagen that is expressed based on this patient's cell type, is it too high, too low, or is it like, extra breakable perhaps? So there's a lot of ways to research this. It's not always easy. Um, but we also know that probably the answer is not just going to be in exactly the genetic variants. There's probably other genes in other parts of people's genetic code that modify their COL4A1 and 2 variants. So, um, two people can have the exact same variant and have very different presentations. We know that for a fact in COL4A1 and 2 because there's parents who are completely asymptomatic who have the variant and a kid who is severely affected. So we are hopeful to get closer to a what we call genotype phenotype correlation, understanding what the variants are that are associated with specific symptoms. But it's probably never going to be as simple as just what is your variant. Therefore, we can predict exactly how what the future looks like. So, yeah, great question. Oh, I see someone talking. Ella, I think you're trying to talk, but let's see.
Can you hear me now?
I can't.
Thank you. There seems to be some subtypes associated with this condition as well, and overlaps of other things such as cerebral palsy, cystic fibrosis, and even hypermobility. Do you think that in your study you may be able to speak to the correlations of some of those conditions or separate them as separate entities as you sort through the data and be able to tease out the information of what is COL4A1A2 specific and then what could be overlapping or coincidental or coexisting conditions at the same time?
Yes, I hope that we will be able to answer those types of questions more concretely. Yeah. And again, it can be hard in a single person to say, oh, is this specific symptom related to the COL4A or not? But when we have dozens of or hundreds of patients and a whole subset of them are having similar symptoms, then we start to see themes emerge and be able to say that we think, in fact, this hypermobility is in fact probably related to their COL4A variant or not. Excellent. Well, certainly I don't want the discussion to end here. I know that the Gould Syndrome Foundation does a great job of hosting lots of different webinars and events. And so I'm hopeful that this has sparked people's curiosity about research in general and also potentially about interest in participation in our natural history study. I am grateful to each and every person who agrees to participate. I wish that we were able to compensate people with money, but we don't unfortunately have funding for that currently. But we are just so grateful, and this is the way that we as a community are going to be able to move forward and provide more answers to you, and hopefully, move forward and make this a disease that is more manageable and better understood worldwide. So thank you so much to the Gould Syndrome Foundation for having me, and Lacey specifically for helping to organize this event. And definitely, please contact me on our email. This goes to our study team if you are interested in, participating in the study or have other questions related to Coal research, then you can definitely reach out. Excellent. Well, I will end there, but thanks everyone.
Thank
you
you.
so much.
Okay.